Dr. Joe Thompson, thank you again. Look forward to what you have to say this morning.
Well, Tim, thank you for having us back. It's been 2 weeks since we were together, and we have some old stuff and some new stuff. So we'll jump in, and Sandra's in my other or in her office beside me, so she's going to drive, and we'll jump in here. I thought I would just start off with an electron microscopic picture of this coronavirus. The corona itself, the crown, is the red aspects here on the attachment sites for the virus. That's where it gets its name. We're now probably 6 months into what has become a worldwide pandemic with this new exposure. We do continue to lead the world in the number of confirmed cases, ahead of any other reporting country. This is, a continued, it's almost a death march that we're watching in real time. On the next slide is the U.S. Impact, where we are now almost 2 million confirmed cases and at least 112,000 deaths. This is continuing to move forward in Arkansas. We've got now over 10,000 cases. 2 weeks ago, when we were last together, we had 6,200 cases. So just to put it in context, in 2 weeks, we've gone from 6,200 to over 10,000. We had 108 people hospitalized 2 weeks ago. We have 173 today. We've doubled the number on ventilators. We had 22 2 weeks ago. We have 44 today. And we've have about a third more deaths at 161. We've talked about the hot spots of Shreveport and Memphis. Those continue. Shreveport with more deaths than the entire state of Arkansas. But I have to, unfortunately, at least put an X on the map here, or star, for Northwest Arkansas. Arkansas is now in the top 5 states for the most rapidly increasing number of new COVID-19 cases. We're tied with Arizona. Arizona just put in place, reintroduced their emergency hospitalization plan that they had suspended. So this is not a good direction that we're moving in, and unfortunately, you guys and gals in the northwest part of the state have some of the greatest exposure. When we look there in the northwest part of the state, I think on the next slide, we've actually got, this is, we talked about this 2 weeks ago. This was, y'all were a pretty quiescent part of the state 2 weeks ago. We did have this small number that was doubling, and we were on the, on the radar screen, but I think we all hoped that that was not going to happen. Unfortunately, it has occurred, and this is now on the next slide. You can see the rate of increase there, the red line. These are the regional rates that Secretary Smith and the governor put out each day just in the last 2 weeks. The northwest part of the state represents that red line with a significant increase. The 2 counties of Washington and Benton County, you've got about 1,200 active cases now. It was concentrated, I think, in the poultry industry originally, but that now is out and in your community more broadly spreading. So cause for concern, a cause for redoubling of efforts. Let's run through the numbers the governor's put out moving forward. Sandra, if you can, these are the new positive cases, and you see this is in part because of the increased testing, but I think you've got more positive cases in the community. Here's your 7-day rolling average for all cases, and then the 7-day for community acquired. You see the community acquired slope is actually determining what the all cases are, because we're not having that many correctional facility cases occur compared to the community cases. We've got a larger number of, on the next slide, the active cases. So these are people that are actively and symptomatically infected in our communities, up to over 2,800 now. On the positive test results, there's been a little bit of a, I think there were appropriate questions, and there's important clarity that is provided now. What the health department and the governor were reporting before were the positives that they had at the point in time of the press conference. What they are now reporting are the positives as of the date of the test. And you can see we're not down in the 2, 3, 4% range. we're in the 6, 7, 8% range of all tests that are done that are positive. And of course, a significant number of those tests are actually to allow elective surgery and are not of symptomatic or potentially exposed individuals. So this is another cause for concern moving forward. Number of people in our hospitals have gone up. This is an important indicator because remember, our goal is to avoid overwhelming the capacity within our healthcare system. We've now got, I think, about 44 folks on the ventilator. We're not pushing that. You know, we've got about 500 ventilators in the state of Arkansas, but you need the personnel to manage 24 hours a day, 7 days a week in an intensive care unit, the capacity to use those ventilators. So we are starting to consume more of our personnel resources in the healthcare system related to COVID-19 itself. We go to the next one. You know, we are increasing our number of tests. It's still below many of those states that are around us, but you know, as we test more, we'll understand more. If we go to the next slide, Sandra, you know, the doubling rate. This is a new indicator from when we came together last time. This is how many days it takes for the number of coronavirus cases or hospitalizations or deaths to double. That regional slide that we showed a few minutes ago, your increased number of cases will make your doubling rate be shorter. The shorter the time frame, the steeper that curve and the faster the spread is in your community. And these doubling rates can reveal hotspots. Now this is a really busy slide. You'll see the gray bars on the far left. If it doubles every day, every 2 days, every 3 days, or every week is that straight line there, kind of going from the lower left to the upper right. The blue line at the top is Arkansas's as a state's doubling rate. Then if you come down Lincoln County, where the original outbreak at Cummins was, it was very steep early on, but it's effectively flat. It's not doubling at all now. Pulaski County is relatively flat. St. Francis, which is where the federal correction facility in eastern Arkansas is relatively flat. But you'll see the next two, the yellow line for Benton County, and I guess that's a green or gray line for Washington County. Those are pretty steep curves, and your doubling rate is, you know, right now, probably on a weekly basis, you all will double the number of cases unless somehow we slow that process down. If we go to the next slide, I just reinforce, you know, the quarantine aspects. If you're exposed, it's a 14-day quarantine. Importantly, that's even if you have a test that is negative, you still need to quarantine for 14 days because the test can be falsely negative. And if you don't get it in the right window, it is frequently falsely negative. If you have symptoms, we're still on the 3 days since recovery and 10 days since symptoms first appeared to come out of your self-isolation and re-engage with your family and your community. Some new information on the therapeutics. You're starting to hear a little more about the plasma, the passive immunity, plasma transfers. There is a company, I think, that will have commercially available monoclonal antibodies probably by the latter part of this month. So I think we are building our capacity to offer people passive immunity. Not a whole lot of new information on the drug side. Some encouraging comments from Dr. Fauci on the availability timeline of vaccines. Some caution on that. His concern there is because this is a coronavirus, which is in the family of the common cold. Our immune systems don't mount very good long-term immunogenicity to the common cold, and he's concerned that we may not, even with a vaccine, mount long-term immunity to the coronavirus. This could be a vaccine that we have to have repeated doses or on an annual basis. We do have a little bit of new information on the mask recommendations. Again, this is probably our best tool to combat the community spread that's going on. I'll draw your attention to the fourth bullet here, a new study that's out in those countries with aggressive face mask policies, or where the cultural norm was to wear a face mask because of, you know, largely the Muslim religious tradition. The mortality for COVID-19 increased just 9% each week on average in those countries that had high adoption, high utilization of face masks. In other countries that did not, the mortality increased almost 50% a week. So while I know we've had some questions and it's logical, but not necessarily, strongly scientifically supported, we're starting to get a little bit of understanding of how important that spread is. And again, just to reemphasize, I can't remember if we showed this last time or not, but if you get infected before you become symptomatic, if you're symptomatic, you're infectious for 4 or 5 days, so you're spreading it around. Those of us that are wearing a mask may have a little bit of protection. Those that aren't are having maximum exposure. Just covering your face and reducing that expression of respiratory droplets will minimize exposure and is our best strategy right now to try to combat, in addition to social distancing and the individual hygiene that we've talked about over the course of the last 10 or 12 weeks. So we've got reopenings going on. The governor is going to make an announcement today because of a request for consideration of regional reopenings. While you all are the hot spot in terms of numbers, the region Northeast Arkansas is one of the legislators there is declaring that they are going to open businesses without these directives as put out by Secretary Smith. The Northeastern region actually has a higher per 1,000 person active case rate. They don't have the volume of population, so you get the prize for having the most people. They had the most active infectious rate in the Jonesboro area and northeastern part of the state. Some of these guidelines can be applied to other businesses that we've talked about before. Again, the phase 1 approach where they were at 1/3 occupancy, again, the governor has stated yesterday that he would address phase 2, moving to that, and when that could happen today. I think the numbers are strongly supportive not moving forward to phase 2. I think the risk is still present. Here are the states that have the highest 7-day average of new cases since Memorial Day weekend and the opening up of states from kind of the restricted space we were in. If you look at just our region, I mean, Tennessee, Mississippi, Texas, and Arkansas, we all have our highest 7-day average since June 1st. So I think we're losing a little bit of control here. That results in changes in the death rate projections. This is the Institute for Healthcare Metrics and Evaluation out of Seattle that the president and the governor and others have referred to. We've talked about before. You will remember that March 25th projection early on, before we had put things in place, the projection was that we would have over 700 deaths in the state of Arkansas by August 4th. They then, because of the efforts that we did on April, revised that down to be 175 deaths by August 4th. Because we were doing so well at the 1st of May, they actually revised it further that we would only have 115 deaths by August 4th. But in June, because of the increase in active cases and the transmission, they revised that number back so that now that escalating line in the burgundy is their projections, and we're now back up into high projected deaths by August 4th unless we're able to regain control on the transmission. So, I think it is going to be an important announcement today by the governor. The community characteristics here, if you have isolated cases or limited community transmission, the mitigation level is low because we don't have transmission. You have minimal to moderate transmission, so this is sustained transmission with confirmed exposure and the potential to increase rapidly. I think that's where our state is. The mitigation level there recommended by the CDC is moderate. If we move to large scale but controlled transmission, and I think that's where you may be in the northwestern part of the state, the need for mitigation is significant. And obviously, if we totally lose control and have substantial uncontrolled growth, we're back to where we were a month or 6 weeks ago. This is not an overly positive conversation. I think our last calls have been a little more affirmative because we were moving in the right direction. I think the numbers are showing us that we are, I'm not as worried about the total number of cases because we're testing more. I am worried about that positivity rate on a daily basis. I'm worried about the doubling in hospitalizations and ventilators since we last talked. The virus is just as contagious as it ever was. It's just as deadly as it ever was. It's just more pervasively present in our communities, and particularly in your area in Northwest Arkansas. So let me pause there and look forward to questions and conversation.
Dr. Joe, thank you. That's good to know. Looks like we got some work to do to tighten back up. I notice when I move around here, I'll be one of the few people with a mask on at Walmart or something, that I see. Not too many. We've gotten a little lax here. Oklahoma seems to be real lax. Went over there to help a friend that's business is in trouble, and it looked like it was wide open. But thank you for that. That's what we need to know. Questions, comments?
I have a question. I have two questions, actually. I know I do every time we're on this call.
You always get two. You can have three if you like it.
Thank you. I appreciate it. But so I saw the governor say the other day that he's sure that none of these numbers that are rising in numbers has nothing to do with the reopening. And I thought that was a little strange. Like, I completely understand why we're trying to reopen, but it seems like that our increase in numbers would have something to do with that.
So I'm not going to speak against the governor, but I think your question is spot on. And I think the rising numbers are directly related to the increased mobility and contact that we're having because we are less restricted. I mean, it's totally different now in our communities than it was a month ago, and the numbers are doubling, and those are directly related. I think what the governor was referring to is in the contact tracing that the health department does, and they ask questions of, have you been to the barber shop? Have you been to a faith-based service? Have you been to an outdoor event? The answers they're getting from individuals are no. And so that's where the governor's comments came from, is that in their contact tracing, they're not having people report that what has been loosened up was a cause for somebody coming into a positive case. But I'll just tell you, logically, if you use your eyes, it's because we're loosening up that we are having these increased numbers.
Yeah, it just seems reasonable. And Tim's right. I don't see people with masks on ever. I mean, I stay at home as much as possible, but so I have one more question that's a little bit different. Is the health community in Arkansas possibly going to speak out or have a say in options to vote by mail in November? Because I tried to post something on the governor's Facebook page. I was very nice and just said, is this going to be an option for absentee? And I got attacked by like a bunch of people. Other people kind of came to my defense, but it was insane. And I was just wondering, because it just seems to me like this isn't a political question. It isn't even about who you're voting for. This is a health and safety question. And so I was just wondering what you thought about that, or if you've heard if anyone's trying to, from the medical community, is who we should be listening to anyway on this. So.
Well, I know our center will come out in support of, optimizing individuals' ability to safely vote and to express, their interests. Yeah, I think you're almost touching on something that people find difficult to talk about. I think we have a denial thing going on here. And I think, unfortunately, some, political viewpoints have tried to capitalize on that denial issue and have actually inflamed or at least energized folks who don't want to believe that this is a real threat or that it will be here in November.
Right.
It's going to be here. It's here now. It's growing. It's not going away. Our bodies haven't seen this virus before. I don't want to be Chicken Little, but I think you have to be realist also and say, the numbers don't lie. And yes, we're going to have to open back up. We're going to have to be cautiously optimistic, and we're going to have to be, intentional on actions that we take when we lose control here. We're going to have communities that totally lose control of this. And I don't know if those will be geographic communities. I don't know if they'll be faith-based communities. I don't know if they'll be, lawyer-based communities, but we're going to have to not deny that this is a new threat in our environment.
Right. Okay. Well, thank you.
Yeah, and the healthcare sector has really done a lot of work to get ready for the larger cases, right? The original projections and again concerns, and they've done a lot of work, and they're serious about it. I mean, we were working with Edwin to get him into the Mercy, and emailed Eric about it. He said, "Yeah, I'll send you over to the command center." And that's how they operate. They're got it organized, and they want to make sure they know what they're doing there. But hats off to them, because we may need them more than we realize. Hopefully not as much. Any other questions? So Dr. Joe, what's the leadership we need to do to try to be helpful, to just wear masks, be diligent, follow the rules? There more than that, or is that it?
Tim, I think unfortunately, the message is still the same message, and it's not resonating as much. It's individual hygiene. It's minimizing if you can go to the grocery store one time as opposed to 7 times a week, go 1 time a week. If there was any way your collective voice could encourage folks or, increase the acceptance of facial coverings, that's probably the single most important thing that we could do. I mean, the way this works, and we know it, you are infectious and infecting other people before you even recognize you're ill. And it's unfortunately, that's the unfortunate reality. And so that means that the only way you're going to be protected is if other people are wearing a mask, because they don't know if they're spewing coronavirus. And it's a tough message, but it's the message that we need to figure out how we can optimally communicate and get folks to adopt their new practice.
Yes. So as leaders, right, within those spheres of influence we all have, we could encourage that and maybe get some masks for each business that could, if someone comes in without one, or those kind of things, right? Like a Whole Foods.
And I think, in your leadership positions, as you interact with other business leaders in public places that you're attending, talk to the manager, talk to the owner. I mean, share what we're sharing here, because, if your voice is not effective, nobody's voice is going to be effective. So, I mean, as you go to restaurants, as you go to places of public access, I think this is a message the governor's trying to put it out, Secretary Smith's trying to put it out. I know you're listening and we're trying to put it out, but it's not spreading fast enough.
Yeah, it seems like we could all afford to be more assertive in influencing the right kind of things. Any other questions?
Dr. Thompson, this is Lane Kreider. I had a question about the comment you made regarding the legislator up in Northeast Arkansas. The Board of Health has been given the authority and has given the authority to Secretary Smith to maintain some sort of control and either limit or allow the reopening of some of these businesses. Have you heard anything? It appears that we took the step into phase 1 and are not willing to go back a step.
So Lane, you're actually, I'm going to take your question and expand it just a little bit. I think what the authority to actually restrict businesses because the health department has a license is the authority that Nate is exercising under his public health. I mean, he licenses barbershops, he licenses restaurants, he licenses gyms, because there's a health aspect to those businesses in protecting individuals' health. And that's what the power has been exercised to close things down under the past few months when we have had those exercised. What you're exposing is, while Nate has the power, he doesn't have a police force. I mean, the way a restaurant gets shut down is they do an annual inspection and find something, or a customer makes a complaint that triggers, or enough customers make a complaint that trigger an investigation, and then that single entity's license gets, suspended or modified. The ability to enforce the public health authority is really pretty thin. And if you got a region that was in a revolt or is led by, local interest to massively open up, it could cause a pretty significant governmental rift that I'll put it this way. I think I'm the only public health person that probably has ever ridden in the state police car with the colonel in the state police. The state police and the public health people rarely get together. And I just can't see how you're going to call out the state police if a region of the state ends up defying the Secretary of Health's restrictions.
Well, we saw that example in Fort Smith play out. And whether it's an alcohol license, right, or some other license to operate a food facility, kitchen, or others, then that I guess there are other chips that could be played. But
there are some other leverage points. You're correct. I just, unfortunately, this is where I come back to the kind of the denial of reality, and then the fanning of those in the political space. We really need to pull together here and not use this as a political advantage point here. And unfortunately, some of that's happening both at the national level, and now it's bleeding into our state's boundaries also.
Yeah. Thank you,
Dr. Thompson. Bruce Dunn. I still haven't figured out the 24-hour 5K, so I'm working on that, and I will invite you. So I'll make sure you're one of the entries.
I think you could be the first in the nation, and you could be
working on it. I promise you.
It's a big idea, Bruce.
I know we've got some virtual events. We're having some fun with that. I think the frustration. So let's take my personal business situation off the table. I think what's happening is that businesses are looking around and they're seeing non-essential stay essential, and thankfully the liquor stores have been open. But you have golf courses, you have nurseries, you have other businesses that have been even doing potentially better. And I think there's probably not an answer, right? But healthcare professionals are certainly leading the voice, and 90 days in, people are closed. There may not be an answer here, Dr. Thompson. I think people are getting desperate, right? And they're trying to find a way forward, and they don't see any help. And
I think you're right. And I think it's finding that balance of how do we move forward and enable people to have their livelihoods, and also maintain kind of the as much protection as we can. I mean, we're not going to be the boy in the bubble that lives in a bubble for the rest of our lives. That's not possible. I was surprised, and I'm curious, it may come up in either later conversations, with the Walton School's report on the state tax results last week, that in April, our sales tax rates were only down 3%. So there's still a lot of stuff happening, but it isn't probably fairly distributed across the business community, and that's part of the frustration that's coming out.
Okay. Thank you, Dr. Joe. Well done.